always need to worry about the risk of blood clots when we have a patient who is pregnant, but what we know is that pregnant people with sickle cell disease are even more prone to developing blood clots during pregnancy and the postpartum period. Some research shows that this can be to 8 to 10 times more common in women with sickle cell disease as compared to peers without sickle cell disease. We've also been able to identify some risk factors of which women with sickle cell disease may be at even higher risk, and that would include patients who have hemoglobin SS genotype, for example, patients who are older at the time of pregnancy, or those who have hypertension at baseline. One other difference between blood clots during pregnancy and patients with sickle cell disease is that the time when they can occur seems to be wider. So for example, in the general population, we think about most pregnancy-related blood clots as occurring near the end of pregnancy or in those first 6 weeks after delivery. But for women with sickle cell disease, that spread seems to be longer. So you can have more events earlier in pregnancy, and that peak that we see after pregnancy seems to last more like 12 weeks rather than 6 weeks. At this time, we don't have evidence-based guidelines to direct the management of clot prevention in pregnant patients with sickle cell disease. But knowing what the risks are tells us that for each patient we meet, we need to consider the risk of blood clots and consider whether that patient may benefit from thromboprophylaxis during pregnancy to try to prevent blood clots. Now, we also need to keep in mind that these patients may be at more risk for bleeding. For example, we know postpartum hemorrhage is more common in women with sickle cell disease than those without. So there's definitely a risk-benefit ratio that has to be considered on an individual basis.